Thank you, Charles. Just before coming up here, Peter from the ministry here in Slovenia told me that this was the place where politicians in 1990 came and for the first time said that Slovenia would become a country. And as a living in a country itself, which is going through discussions in that space, I guess it makes it an interesting place to be. I do feel quite a long way from home, and so I wondered, is there anybody here from Scotland today? But thank you. But when I was travelling through the airport yesterday, I saw quite a lot of people wearing kilts and wearing garments which suggested some affiliation for Scotland. And so what I now have in mind is this idea of a dementia tartan army crossing Europe and engaging in dementia activity. I'm also very grateful that the conference is being held in English, and I must confess that I'm finding it easier to follow than last year in Glasgow, where I found the accent quite strong. For the presentation I'm going to offer you today, and it's quite technical. It talks about where we are in preparing the next joint action and what the joint action will be involved in. I've been assisted by colleagues from across Europe who are leading on each of the work packages. So this is one of those very rare occasions in which I've been able to come to an event and somebody else has written my slides for me. So I'm going to try and cover that. One thing I should say is that the slides have quite a lot of text on them, and having previously been to an Alzheimer Scotland event a couple of years ago where I was given very strong advice on using text on slides, and the degree to which if you talk and people read at the same time, it can be quite difficult to follow. I was advised it caused cognitive dissonance. What I'm suggesting is that either you put your fingers in your ears and read the slides, or you close your eyes and listen to me, in that you will get, there is an evidence base, but you will get considerably more from the presentation if you do one or the other, and I will not be offended if I see you doing either of those. So, where are we? I'm going to cover a range of items. I'm going to talk about the different components of the joint action. And a joint action under the European rules requires to be taken forward through work packages. So I'm going to talk about each of the 7 work packages and the objectives and outcomes that we're looking for between 2015 and 2018. We're in the process, hopefully this month, of finalising the proposal. We've been in discussion with the European Commission across the summer, and we would hope that we would complete that work sometime in the next 4 or so weeks. The project will involve 15 organisations from 13 countries, and within that, Scotland will take a coordinating role in that we will bring together work being taken forward and led by France, Italy, the Netherlands, Spain, and the UK government, and Norway. Norway is the only non-EU state involved in the joint action. The overall aim of the project is to promote the implementation in member states of coordinated actions to improve the situation of people with dementia and their carers, building on the outcomes of the ALCOVE joint action. And we've been very fortunate through the process in that those people who were involved in ALCOVE have been able to give us both the learning around the process, but also the materials that they produced through the ALCOVE work, and so we're very grateful to them. In terms of the key objectives, and these are genuinely high level, to provide evidence on how to improve outcomes for people with dementia and their carers, to enhance and strengthen EU collaboration on improving dementia services and support, including early diagnosis, and we had some discussion of that in the first set, but also to add value to existing activity across Europe and globally on improving diagnosis and the quality of services and supports for people with dementia and their carers. And this third component is where we are, as part of this process, looking to go beyond simply consensus studies on what the evidence tells us to give you more information, to actually use a significant part of the 3 years in actually testing activity on the ground to work through the implementation of approaches. We have really good evidence of what can be effective, but in most countries the challenge is to take that evidence into practice so that people living with dementia and their carers take the benefit. So our focus through this joint action will be in that implementation space rather than in the knowledge space. Work Package 1, coordination and dissemination, that's telling everybody what we did. We will lead those from the Scottish Government, and we'll be appointing a very small team to take that forward. There is significant work in arranging activities, but also in reporting to the European Commission in terms of the use of funding, and so we will produce that. Work Package 3, again, this is a key structural component of the agenda, is the work that will be taken forward on evaluation. And this is going to be led by an organisation called ACUAS in Spain, who took forward the evaluation of the first joint action. And so that means there's also a continuity there. The aim is that actions are undertaken to verify that the joint action on dementia is being implemented as planned and reaches the objectives. So there's two components to that. An assessment of, did we do what we said we would do? But also, did we get the outcome that we said we would get? And those are both important components of the evaluation. Through that means that ACUAS will be looking at the initial and ongoing work package activities. They'll assess the quality and impact of the implementation of the joint action. And they'll also look at the degree to which the deliverables that people have said at the beginning are actually assured as delivered as the process goes forward. So they're working to a 3-year plan, a draft report on evaluation, a report on data collection and analysis for the first internal evaluation, and that takes place generally around 18 months in. That's the point at which the European Commission gives us some money on the basis that we've done the first chunk of things that we said we would do. And then a final year 3 report on data collection for the second and final internal evaluation and the public report. So they will take that forward. Work Package 4, diagnosis and post-diagnostic support, and this will be led by colleagues in France, and indeed those colleagues in France who are involved in ALCOVE. And when we had the discussions in Luxembourg about the formation of the joint action, this was the work package which was probably still of the greatest interest, in that of the 13 or so countries who are represented in the room, more than half at that time said that this was the area of work which was the most material to them at this point in time. And that's interesting because diagnosis was one of the elements of ALCOVE. There was an evidence-based toolkit produced as part of ALCOVE. That toolkit is available across Europe to be used, and yet still with that knowledge and evidence, people are still saying that this is the greatest challenge at this stage to systems in terms of identification and initial response to dementia. We've said that while Scotland will not be part of that work, having done some work on diagnosis in Scotland, we've also said that we will also offer such support to the work as we can as the work goes forward. A range of objectives, some again covered this morning, to define the benefits and risks of the diagnosis of dementia, thinking about patient and carer needs, but also to develop an optimized diagnosis strategy, to think about post-diagnostic goals. And again, in Scotland, we're working through that as a set of challenges. Within Scotland, 2 years ago, we made a national commitment to 1 year's post-diagnostic support to everybody with a new diagnosis of dementia. We are finding that remarkably challenging to deliver. At this stage, heading towards 2016, which is the delivery date, my assessment is that we probably will not break 50%. At the same time, my assessment is we are offering more post-diagnostic support in Scotland than any country in the world. So I think the scale of the challenge in that area is enormous, and I think we ourselves are going to be looking again at the methodologies to take that work forward. So year 1, very much again about literature synthesis, what's the evidence, thinking about the things to be tested, getting towards the publication of an evidence report in year 1, the sort of material which under ALCOVE would have appeared in year 3. Year 2, looking to actually think about how that is applied, and year 3, thinking about how that's being applied, particularly in primary care settings. I think what we've seen from the first phase of work on this across Europe is very differential approaches to how diagnosis is optimized in different countries with quite different outcomes. Now, my assessment is that this will ultimately be system specific, in that how things work will work best for you in your own national systems. There is no one answer, in that it has to understand the broader interaction of primary and secondary care services, but there is certainly a role for primary care which perhaps has been underplayed in some jurisdictions. The second substantive work package 5, is around crisis and care coordination. And this area is really interesting to us in Scotland, but also interesting to a number of other countries. So the Netherlands will lead this work and be supported by Bulgaria, France, Scotland, and the UK government in London. Again, Alcove did work on this, but this is an area which is of particular interest, I think, to all health and care systems across the world at the moment. So at the moment, through failures of anticipation, of prevention, and of response, too many people with dementia end up being hospitalized and receiving poor quality care outcomes. They become re-hospitalized and they become institutionalized. And those effectively, in many cases, are expensive failures which damage lives. And at the moment, we are scratching the surface. We are at the beginning of the process of learning how to respond effectively. And there are individual local services that are doing well in this space, but there is no country that is doing well in this space. And the real challenge is for whole systems to become adept and able to respond, to avoid and address crisis when it occurs. Again, a process which works through mapping and developing the evidence base, and there's some really good work from France and Italy, from Alcove, which was led by them in the first round, which we want to build on, but then taking that into implementation, focused on the application also of improvement science methodologies. So thinking about how it is that we take change from policy into action. Without action and without implementation, strategy and policy are worthless, in that people don't take outcomes from strategy. People take outcomes from practice, and so that means that we must support practice. And the objective there is to learn what the barriers and how to overcome the barriers of applying the evidence. Work package 6 is around quality of residential care, and Norway will lead this. And again, focusing on many of the challenges that countries across Europe have faced in terms of the degree to which we see poor outcomes for people living in residential care settings. Certainly our experience in Scotland is that this is an area where people can appear or be neglected, where they can have poor quality of socialization, where they can have effective isolation, where and many of the challenges that we've had are about the degree to which people are actually able to go outside and have time in the open air. People continue to socialize with people beyond the care workers and the other people within the environment. So this work package is looking to pilot improvements in 5 areas: the physical environment itself, organizational issues, the use of medication, psychosocial intervention, and end-of-life issues. And again, also getting into some of the really quite challenging areas in that space around how, as the degrees progresses, it may manifest in different ways, which requires different responses, which need to be less blunt. And I guess in that space, we're talking about less use of psychoactive medication and more focus on the behavioral approaches that can be taken. Again, beginning by looking at the evidence base, looking by what we know already, setting the context, but then beginning to work through and identify examples of good practice, to work within, to actually take that practice into particular sectors, to actually learn from the application of the evidence, and again to try and bring that into the public domain and the space so that we can actually think about how it is that we produce better outcomes in those areas. The commitment they've made is to try out a model of best practice care for persons with dementia and residential living in a small scale, and to evaluate these tests by performing several small interventions. So the objective within this period is to test evidence which has been developed in terms of routine practice in small scales to see whether we can generalize that. Finally, Work Package 7, Dementia-Friendly Communities, which has been led by the UK government, and I'm glad to see colleagues from the UK government here today, supported by work package partners from Bulgaria and from Greece. And the objective here is to empower people with dementia to continue to be able to actively participate in society and remain independent for as long as possible through reducing stigma, isolation and fear, through increased community awareness and understanding. And this dementia-friendly community work is a discussion which is taking place across the world, which has been trialled in many jurisdictions. The objective here is to begin to maybe bring some coherence to this, to identify evidence-based examples of best practice, but then to test that evidence in different locations to see what learning it gives about the process of nurturing and sustaining dementia-friendly communities. Again, a 3-year plan, a first year which is sharp and focused on identifying what's to be tested, a testing period, and then an evaluation period. And in practice, the evaluation and testing will probably run well into year 3. The objective there is to then share the knowledge both of what the evidence said, but also the practice of implementation so that people can understand better the process that needs to be worked through to take it into action. And that's me. Sorry.
Thank you very much, Geoff, for an interesting talk.
Charles, I should also say that we've been very pleased through the process to have the collaboration of Alzheimer Europe in the process. One of the things which we also said about how we wanted to take this work forward, which is differently from how previous work actions have been taken forward, not just in the field of dementia, is that we expect to take it forward fully with the involvement of people living with dementia and the people who care for them. And so Jean-Georges and Alzheimer Europe have very graciously agreed that they will facilitate that work for us and they will assist us for that work at a European level. But we'll also be looking for national associations and local partners to facilitate that work within the localities where the work is taking place. So our objective with this is that this work programme, this joint action, should feel different from previous joint actions and should have the currency of having been developed with people living with dementia. Sorry, can I thank you for your attention? I noticed that very few of you had your fingers in your ears or your eyes closed, which does make me concerned that you may not remember anything I've said. But I understand the slides may be available. Thank you.